Thank you for waiting. I know it was we are a bit backed up right now in the hospital. It's a busy night. My name is Dr. Cozy. I am the head of the psychiatric unit here at the hospital. It's really nice to meet you. Really quickly, can I just get you to verify for me your name and date of birth? And is it okay with you if we talk, if I ask you some questions? Okay. First things first, as far as our conversation goes, I want you to know that you are in control here. If there's anything that I bring up or ask that makes you feel uncomfortable, I want you to let me know right away, okay? It's very important to me that you hold up your boundaries and that you are aware that if at any point you don't want to talk about something, you don't want to answer a question, you don't have to, okay? But if it's okay, I would like to start. Okay. So first things first, can you tell me a little bit about why you're here? Okay. Has this been going on for a while? Did it suddenly start recently? Is there a start date or? Is this the first time that you felt this way? I do have to ask, and this one would really be helpful if you would answer honestly. I mean, you absolutely can pass, but it would help me to know. Do you have any history of mental illness, personality or mood disorders, spectrum disorders, or? Have you been seen or following up with any doctors, psychologists, counselors for this? Have you ever taken any medications to help manage mood or stabilize mood, depression, anxiety treatments? What was the reaction? Okay. And again, another kind of personal one, but this one I need to ask on the chance that we need to administer any medications here, and we want to avoid any kind of interactions. Have you consumed alcohol or any illicit drugs within the last 24 to 48 hours? Okay. Do you feel safe right now? Do you feel any kind of feeling that you might harm yourself or feel like you'd want to in the next few hours here? Do you feel comfortable with me doing a quick exam? Okay. We do like to do a kind of brief neurological overview just to make sure that we rule out any underlying issues that may be part of something else, okay? And again, if anything that we do feels uncomfortable, overwhelming, or just bad, let me know, okay? And we'll stop. So, first thing I would like to do is I have this Penlight here, okay? Going to be flicking in and out of your eye and just making sure that your pupils are equal and that they're reacting to the light and then the removal of said light, okay? Try to keep your eyes open. You can look right in between my eyebrows here. Then without turning your head, just keep your head as still as you can. I want you to follow my light, just using your eyes. Do you feel comfortable closing your eyes? You're willing to try. Okay. I have here just a little cotton pad, okay? What I'm going to do is just kind of brush it on different parts of your face while you have your eyes closed. And I want you to tell me where you feel the pad touch you, okay? If at any point you feel uncomfortable, please go ahead and open your eyes, alright? Okay. So, close. Good. Good. can go ahead and open your eyes. I have this wheel here, and it is spiky, but as you can see, as I run it over my finger, it's not puncturing the glove. It doesn't hurt, it's just a little bit irritating. Okay, so I want you to tell me when you feel this touch you. We'll do the other side. Yep, that was right away. Good. Okay. Okay, so then we're going to do some cognitive tests here, okay? So, I am going to whisper a sentence from a known, childhood song, and I want you to finish the sentence for me, alright? So, I'm gonna do something like, twinkle, twinkle, little. Exactly. Good job. So then, the itsy bitsy. Yep. Went up the water. Good. Okay. Mary had a little. Good. Okay. Row, row, row your. Okay. And let's see. Hickory dickory dock. The mouse went up the. Good. And how about in the next view, we're gonna do numbers. So I want you to give me the number that comes after where I stop. Okay. 7, 8, 9, 10, 11. Good. 24, 25, 26. Good. 250. right? Okay, so then okay, so here I've drawn the cock, okay, and I want you to point for me, where would the 4 go? Good. How about the 11? And the 8? How about the 2? And the 5? Perfect. Okay. Can you identify this smell for me? Good. How about this one? Yeah. I don't know why these aren't all the same kind of bottle, but this one? Good. Okay. Now do this one. Perfect. Okay. Is it okay with you if I touch you? Thank you. Alright. I want you to tell me when you feel my fingers make contact and when you feel me let go. Good. Again, when you feel the contact. Good. When you feel me let go. One more time, when you feel it. And when I let go. Good. Excellent. One last test, and do you feel comfortable closing your eyes again? Okay, good. So close them, and I want you to tell me which side you hear my fingers flutter. Good. Good. Yes. Yes. Good. Good. You can open your eyes. So neurologically, you seem stable and lucid. Cognitive function and sensory function, they're intact, so that's good. We like to rule out, like I said, any kind of neurological issues going on, because sometimes those can present as an extreme shift in mood. So, and actually sometimes it can even be gradual. So we just need to rule that out. So now, I'd like to ask, how are you feeling in this moment? Are you feeling any physical manifestations in your body? Sometimes people feel some shoulder pain, headache, just heaviness overall. Okay. Okay. If it's okay with you, I would like to ask you now some more potentially sensitive questions, if that's okay. If anything feels too uncomfortable, please feel free to say pass, okay? Okay. So the first question is, do you have any history of any kind of hallucinations, whether auditory or visual, even like a phantom touch. Do you ever disassociate or feel like you've lost time? Like perhaps you'll zone out and all of a sudden like a few minutes have passed or even longer. Do you ever feel the need to participate in any kind of rituals, whether it's washing your hand, knocking a certain amount of times, particularly needing to do a set of tasks in a certain order? Okay. Do you ever have intrusive thoughts? Like something pops into your head and you just can't stop thinking about it, and frequently they can be disturbing. Okay. Do you have a difficult time in social situations, whether it's initiating a conversation or just feeling comfortable talking to people? Do you have any issues with organization, whether it's organizing your thoughts or keeping papers, keeping your things organized, finding things? Do you ever have a hard time reading other people's emotions? Do you struggle with the feeling of being alone? And do you have any history of self-harm? I know that's a sensitive question. Okay. So I would like to admit you for observation for at least the next 24 hours, and then we can reassess at that time, okay, how you're doing. How do you feel about that? I completely understand. I have been in your position before, and I completely can empathize and understand how scary and uncomfortable and even how stigmatized that is, right? Totally get it. I want you to try to reframe it in your mind, okay? So, if you have been working really hard and you're tired, you're stressed, you're burnt out, you would rest, right? And you wouldn't feel badly about that because that's what your body needs from you, right? Right. If you injured yourself, like you sprained or broke a bone, you would go get treatment. You would take time out from your regular activities to give that body part a chance to heal. And again, you wouldn't feel judgmental towards yourself about it because you need to honor your body and take care of that injury. Mental health can function in the same way. Sometimes our issues can be chronic. Sometimes they can be acute, hit out of nowhere, and extremely overwhelming. Sometimes they're triggered by other things. But regardless of the cause or the root, it's important to honor our mental as well. Just like we would if we had a sprained wrist or a broken ankle. We need to help and nurture ourselves and take that time, and sometimes that means putting ourselves in a situation where we let other people take care of us and help guide us through. That can be in the form of just taking a break from your life and spending some time in a safe facility where you have people who are trained and experienced to help you. A lot of times friends and family, they mean well, but they just don't either have the experience and background to really relate to what we're going through or to know what the right things are to say. Or they may not have the emotional stamina because depression is a really big emotion. It can be. Same with anxiety, and they can occupy a lot of space. And, it's almost like you become like one of those zombie insects that are taken over by a parasite, and you don't even really have control over what's going on with you because those experiences are so powerful. And like anxiety can completely derail you from everything you had planned to do and completely consume all of your thoughts. It's important that you allow yourself to be in a place where people understand that and can help and ground you and guide you through it. Help you center yourself and also feel safe. Okay? You are safe here. There are other people in the facility that are currently staying for similar reasons, and you can talk to them or not, completely up to you, okay? But the reason why I want to be upfront about that is so that you know that you're not alone, okay? It is not something to be ashamed about or feel like there's something wrong with you, because a lot of people go through this and a lot of people come out the other side. Okay. You're safe here. How do you feel now? Okay. Well, let's do a quick grounding thing together, okay? I'm going to reposition myself as well. Alright, so I want you to uncross your legs, okay? And feel your feet on the step of the exam table. And I just want you to take a moment and just feel that physical connection, that pressure underneath your body. I want you to bring awareness but just having that awareness of being in your body right now. Knowing that you are physically here in this place. I'm with you. We're together. You're safe with me. And I just want you to feel physically your physical self in this space. And that right now, you're okay. Your emotions might be big, but that's alright. You are okay. No matter what you're feeling, you're okay. So now I want you to take a deep breath in with me. And breathe out. I want you to do that again, only this time when you inhale, I want you to hunch your shoulders. So inhale. And as you exhale, release them. Good. Let your arms and hands hang heavy. I want you to focus on squeezing your toes. And then relax them. And then the same thing, I want you to squeeze your hands into fists. And then relax them. And again, let your arms hang heavy. How do you feel? That is sort of a grounding exercise that can kind of help you come out of wherever your head might take you and just bring you back to the moment. So, just a moment, I'm going to take a few notes, okay? And then I'm going to go speak to our charge nurse and see what we can do about getting you moved upstairs, okay? gonna do one more thing. So I'm going to hook you up to the monitor here with our blood pressure cuff, because I am going to be stepping out of the room for a few moments to talk to our charge nurse. And you do have a button right there that you can push if you need someone to come in here. But sometimes people don't feel able to do that. I know for myself in my previous experiences that I can get kind of locked in myself. And so because of that, I like to give our patients a blood pressure cuff. Because often if we start experiencing panic, our blood pressure goes up. And if that happens, this is going to beep and alert us to come in here and help you. Okay? Do you have a preferred arm? So it's not irritating. So, okay. When the time comes that we're gonna take you up, we'll remove that. But you will feel it intermittently tightening and loosening, okay? Probably about every 10 minutes or so. I'm going to step out, okay? So, if you feel unsafe or overwhelmed, just uncomfortable even with what you're feeling, if you have any intrusive thoughts, anything changes and you don't feel okay, I want you to push that button. But also if you can't, I just want you to know this is going to go off. That's going to tighten, and it'll alert us to come in here as well. Alright? Okay. You can also yell if you want to. No matter what, we'll come in here and check on you. Make sure that you're okay. Okay. So it should be just a few moments, all right? And then I'm going to meet you upstairs.